HIV Prevention and Treatment.
Brought to you by Langside Studios.
HIV/AIDS is a disease that is transmitted through bodily fluids, including blood, semen, and breast milk. It's believed to have originated in monkeys in sub-Saharan Africa. In monkeys, it's a non-lethal disease. Its transfer to human came as a bit of a shock and is suspected to have been passed on accidentally in laboratories and or through contact with infected blood when hunter-gatherer tribes hunted chimpanzees. HIV, human immunodeficiency virus, which progresses into AIDS, acquired immunodeficiency syndrome,
Please ignore the following typo.
is a disease that impairs the human immune system. The difference between the two is difficult to understand without first understanding the inner workings of the human immune system. Your body's ability to fight disease is dependent on its ability to detect foreign materials, recognize them as a threat, and develop antibodies to get rid of them. CD4 lymphocytes are the cells that send a message to activate your white blood cells and start your body's immune response.
Now back to HIV. When your immune system is compromised by HIV, your body lacks CD4 cells and is unable to start the immune response. The average person has a CD4 count between 900 and 1200 cells per microliter of blood. When you contract HIV, that drops to roughly 500, and you're considered to officially have AIDS when that drops to 200. Diagnosis for HIV includes a blood test to check for the presence of HIV antibodies. Early diagnosis is difficult, however, because antibodies can take up to a month to reach a detectable level, and people are most infectious in their first few months of exposure. HIV-positive individuals may be asymptomatic or may exhibit mild flu-like symptoms. As it progresses, other symptoms may include swollen lymph nodes, weight loss, fever, diarrhea, and cough, all of which are common symptoms of less serious illnesses, making an HIV diagnosis more likely to be overlooked.
Now, if science was perfect, we would have a perfect HIV prevention drug and a perfect HIV treatment for those who are already infected. However, such perfection has not yet been achieved. Here's what a recipe for the ideal HIV treatment and prevention drug would look like. The ideal drug would be a one-time use. The current HIV treatment is an intense regime that takes over your life, including daily medication and strict adherence. The new drug would be 100% effective, and it would be accessible. HIV drugs on the market today are fairly exclusive to developed nations. Treatment in rural or underdeveloped areas is sketchy at best. The drug would be universal. It wouldn't be just taken by at-risk people, but by everybody. It would be non-invasive, and it'd be cheap to produce and obtain. Current medication is wildly expensive. A vaccine is the most likely option to include all of these criteria. However, one does not exist. Yet.
Here are the current methods for treatment and prevention that we do have. The first one, which also happens to be the most effective and widely used treatment option, is antiretroviral therapy, or ART. This is an extensive, invasive treatment involving daily medication that slows the rate at which HIV makes copies of itself. Unfortunately, the drugs don't kill or cure the virus. Instead, they change HIV into a non-life-threatening, though still chronic, manageable illness. Antiretroviral therapy is also used as a preventative measure for HIV-positive pregnant women to reduce the likelihood of transmission from mother to child in utero, during birth, and while breastfeeding, though breastfeeding is not advised. Currently, the antiretroviral therapy regimes available are a combination of drugs that need to be taken regularly, multiple times a day. The most difficult part of this management plan is the adherence to strict therapy regimes. In addition, the current drugs available have many possible side effects. Short-term side effects include nausea, vomiting, diarrhea, and headaches. This is the point where most people give up on their therapy regime because the first few months on the drugs are pretty terrible. Some of the long-term and more detrimental side effects include lipid redistribution. This is when fat in your body moves away from where it's supposed to be, making organs including your heart and kidneys more susceptible to stress and damage due to lack of their protective lipid layer. And nerve damage, which can result in a decline in cognitive abilities. Oh, and by the way, this therapy will cost you $10,000 to $15,000 US per year.
It's the one and only Digo Double G. Snoop Dogg. You know I'm mobbing with the D.R.E.
Next on the list is Truvada, which was recently approved by the U.S. Food and Drug Administration. It was originally developed as an antiretroviral drug, but it has also been found to prevent transmission to uninfected people who are at high risk of contracting HIV. For effective use, Truvada is supposed to be taken daily before and after HIV exposure. The concern for scientists now is that HIV will become resistant to the drug due to improper use, and a super HIV will develop. Other concerns involve people assuming that they are 100% protected when they are not, which can lead to increases in risky behavior. The current cost for Truvada therapy is roughly $20 per pill. A lot of research still needs to be done on the effectiveness of this drug, especially concerning the varied effectiveness that has been observed in certain ethnic groups.
There are also several alternative therapies and prevention methods that don't include taking medication. The first of this is good old marijuana. Recent studies have shown that supplementary medical marijuana use can help alleviate the side effects of antiretroviral therapy, including lipid distribution, nausea, and neuropathic pain. Interestingly, it was also found that cannabis can inhibit HIV progression by slowing its rate of replication and can help lessen many of the emotional effects known to accompany HIV infection, including depression, anxiety, and stress.
Next on the list, we have condoms. The male condom is currently the #1 recommended prevention method for HIV, which is roughly 80% effective. Female condoms can also be used and are an option for women whose partners do not want to use a condom. Next to condoms, circumcision will reduce the rate of HIV transmission in men more than anything else, with the rate of HIV transmission being approximately 60% higher in men who are not circumcised. As with many prevention methods, one of the downsides to this statistics is that HIV unconfirmed or positive men are often engaging in less protective sex because they think being circumcised is protection enough, which is not helpful for their partners.
Arguably, one of the best HIV prevention methods is education. People need to be educated regarding the various forms of prevention and protection because no one solution is good enough on its own. There is also widespread misconception about prevention options and genital hygiene in general, which contribute to an increased HIV transmission. Some of these include that frequent douching contributes to good hygiene when it can actually increase the likelihood of contracting an STD. Also, various cultural groups have differing beliefs, such as in Nigeria, where they believe that the best way to be cured of HIV is to have sex with a virgin, which is not only inaccurate, but also increases transmission.
One example of education being used as prevention is a study that was conducted to test the possibility of using popular music as a tool to increasing the effectiveness of HIV prevention programs for adolescents. Based on research regarding the effects of lyrical content on adolescent behaviors, the authors proposed the use of music in improving sex education efforts. These programs are meant to increase students' awareness of the consequences of risky behavior and how it can be unknowingly encouraged.
One of the more progressive HIV prevention ideas involves studying the genome of a group of people known as long-term non-progressors. Less than 5% of the HIV-positive community is considered a long-term non-progressor, which means that they have maintained a CD4 count of greater than 500 without using antiretroviral therapy. Scientists recently discovered an essential protein, HIV GAGP-24, located on their cell membranes that is critical for maintaining elevated CD4 counts. Researchers are attempting to find a way to make this protein transferable to the general population. This is not a cure, but rather it would make it possible to live with HIV asymptomatically and not have it progress to AIDS.
It's the one and only Digo Double G. Snoop Dogg. You know I'm mobbing with the D.R.E. Yeah. You know the West Coast is back for all you suckers. So put something in there. Put it in there. Yeah. Top dog, fight them all. Yeah, I'm burning it up.